Welcome to Balanced Beauty Talks, the podcast where we redefine skin health through a holistic lens.
I'm Natasha, an esthetician and nutritional practitioner passionate about helping you nourish your skin from the inside out.
I'm Dr. Khadija, an esthetician and naturopathic doctor here to explore the natural pathways to radiant skin.
And I'm Alicia, an esthetician and skincare enthusiast. Together, we're diving deep into the world of aesthetics, merging modern treatments with internal wellness so you can achieve long-lasting results without compromising your health.
Whether you're a seasoned professional looking to elevate your practice or someone seeking effective solutions for conditions like acne, you're in the right place.
Join us as we share expert insights, inspiring stories, and practical tips that empower you to embrace a truly balanced approach to beauty.
So get cozy and prepare to transform the way you think about skincare.
Welcome to Balanced Beauty Talks.
Please note that the information provided in this podcast is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Your health and well-being are important, and we encourage you to make informed decisions.
Hi guys, and welcome back to Balanced Beauty Talks. Today, for those of you guys who can't see me, it is just I, Natasha, and I'm here interviewing one of my good friends and colleagues, Natalie. She is the owner of Lux and Lab in Colorado, and she is known to be the skin pen queen. So thank you for coming, Natalie.
Thank you for having me.
Let's start by just having you introduce yourself. Tell us a bit about your story.
Sure. I am Natalie Anchondo. I own Lux and Lab Aesthetics. I'm also a provider there. I've been an esthetician since 2020. I am very, very passionate about acne, skin in general, but I like acne because I definitely suffered with acne for quite a few years. Once I went to a different esthetician and I had done microneedling with her, and that is what actually convinced me to become an esthetician. And I was like, whatever this is, I want to do it. So I went back to school, became an esthetician, and here we are.
Okay. So at what point in your career did microneedling just kind of become your thing, like your niche?
Honestly, as soon as so I'm not sure if it's the same in Canada as it is here, but here you have to go back and get a different certification for it. So as soon as I became certified, that was what I promoted the most because I knew the results people could see from it since it had done that for myself. I've gotten really good results. So as soon as that happened, I started promoting it a lot. I started taking advanced classes over microneedle peels, all the different things. And I just really embodied it. I started studying the skin because I wanted to know exactly how microneedling was working, etc. And it just became something I almost became hyper focused on, and it just became my personality.
Totally.
Honestly, but that's what makes me good at it, right? So
yeah, totally. Yes, Natalie is definitely a leader in microneedling with skin pen in our industry. She teaches courses online on it. Okay, so if you were to explain why microneedling is your ride or die and what makes it so powerful, what would you say?
I would say it's my ride or die because, quite frankly, I would say 99% of people that come in to my spa could use a microneedling treatment. I'm able to use microneedling for many, many things because it's so healing, because it induces the body's natural healing response. So whether I'm working on melasma, acne, rosacea, perioral dermatitis, really many, many different conditions, wrinkles, obviously, I can use microneedling as a tool. And not only is it going to help with that condition, but it also changes the function of the skin long term. So I'm not only getting them results in the moment, but long term, I'm actually fixing their skin or changing their skin. And as a provider, that's what I want to do for people because I don't want it to be that they have to come every single month to be able to maintain. I want them to come every month to see me, but not to be able to have good skin per se.
Totally. Yeah. More of a maintenance and working against time and gravity. What would you say microneedling can do that other treatments can't? Why is that your number one?
Everything.
Yeah. I knew you were going to say that.
I think it can do everything. No, but honestly, so I use it for fungal acne. I use it for all types of acne. I use it for both subtypes of melasma, right? which would be epidermal melasma, and then dermal melasma, which is very hard to treat, but you can use microneedling for that. I use it for 2 subtypes of rosacea. I use it for like wrinkles. I use it for sun damage. I use it for literally all the things that you could think of. The only thing that we can't really treat with it would be something like vitiligo, because that pigment is gone, so we cannot replace that. And then outside of that, like, I mean, somebody with like a crazy skin rash or something, I'm not touching that. But like, yeah, within the normal skin biology, like I feel like you can treat many, many things with microneedling, and I love it because the downtime is so minimal. You get amazing results, and no matter what, whatever we're treating, let's say we're just treating rosacea, you're getting rosacea and anti-aging and better skin function. So I'm not just treating you for rosacea. You're getting like all of the benefits. And I will say, when I first opened my business, I just did facials, and now those exact same clients come to me for microneedling over and over again, because their minds have shifted as well. Like, hey, this is more beneficial and a better, I guess, use of my money than coming in to get my face massaged, even though we like both.
Yeah, absolutely. So true. What do you think, like microneedling in general? Actually, let me back up. So when you're looking at the industry as a whole, we're seeing treatments come and go all the time. Like there's fads and then they disappear. Why do you think microneedling continues to stand the test of time?
Microneedling, I would say, definitely stands the test of time because there's way less risk with the treatment than such as like a laser or something like that. And then in addition to that, because of the fact that it's using your own body to do the work, I feel like minimal downtime, your body is doing the work for you. Like if I could tell somebody, hey, do you want to go on Accutane, or do you want to come to me and I can microneedle you and I can teach your body to heal your own skin? Most of the time they're going to choose for their body to heal their own skin. And so that's why time and time again, microneedling is going to be the treatment that withstands time, because of the fact that it's not like too inventive where like, now we have, I don't know, 5 other treatments that do the same, like lasers. There's a lot of that. But with microneedling, truly, it can treat pigment. It's treating collagen loss. It's treating acne. You could treat multiple things at once and still get amazing results at the end. And it's really your body doing the work. You're just guiding the body into doing that work.
Yeah, that holistic approach is really leading the industry. I feel now there's been a lot of frustration around other technologies and around other kind of, right? And we're leaning back on microneedling. Like it had its moment a while back, and then I feel like it kind of got a little quiet for a bit, and then maybe it's you brought it all back, but
I think it's all of us.
Yeah,
we're all talking about microneedling.
We are. Yeah. It has a big moment right now, which I love.
Yeah.
I love to see that. So the holistic approach is everything. And I think people are starting to recognize the need for that. So yeah. So let's get a bit sciencey. You kind of did a little bit, but let's dig a little deeper and help people understand a little bit more about what goes on in microneedling, like at a cellular level, and why it works.
Okay. So essentially, when we are going into microneedle the skin, we're causing the body to set off alarms. So we're going to be raising something which are called the pro-inflammatory cytokines. These cytokines are something that are called signaling cells. So what it does is it signals to the body that, hey, we need growth factors here. Hey, we need more circulation. We need fibroblasts. Fibroblasts are what is going to give us collagen. Okay, so when we tell the body to set off these alarms, what we do is essentially we call in more of what we want anyway. We're calling in the collagen, and what we're doing is we're telling the skin to regenerate itself at a cellular level, and we are replacing damaged tissue with new tissue. That is why over time, like even somebody with acne, you're essentially but you're telling the body to replace this tissue that is not functioning properly, that's constantly misfiring, and you're telling the body to replace it with tissue that knows what it's doing and that is firing correctly. It's just like if you go to the gym and it's like you start working out muscles that really haven't been worked out for a while, right? Yeah. At first, you may not have the best results. You may not be super strong, but you're going to see that your body is going to change. But you know that over time, doing that repetitive movement, doing those same exercises, you're going to get strong, and overall you're going to become healthy. Your bone density is going to get better. You know, you're going to have better muscle tone. You're going to have better circulation, all these things. It's the exact same thing with microneedling. As we continue to do microneedling, we are essentially working out the skin, and we are replacing this old environment with a new environment. And then we get all the benefits of that new environment, which would be fresher, younger, healthier skin, essentially, that knows properly how to function for all the issues.
That's a really good explanation. Yeah, it's a workout for your skin. Let's talk a little bit about the technicalities around microneedling, like why depth, technique, timing is also critical and part of the process.
So it really matters because if we are working on, let's say, melasma, whether it's epidermal melasma or dermal melasma, it's in separate parts of the skin, right? We have 3 layers of skin: the epidermis, dermis, and hypodermis. So depending on how we're going to microneedle is going to depend where we're going to actually reach. So it would actually be surprising to a lot of people that when you're treating that dermal melasma, which is in the 2nd layer of skin, you actually want to go not as deep because of the fact that you are at risk for more of an inflammatory reaction than what we see with epidermal melasma. So understanding skin, and I preach this all day long, it is so important because you have to understand, 1, the issue at hand. What are we working with? Acne, rosacea, etc. 2, where does that lie in the skin, and what is the acute problem that we are seeing? Is it because of inflammation? Is it pigmentation? What is it? Melasma is not actually a problem of pigmentation. Pigmentation is a secondary reaction to the inflammation that we're seeing. And so understanding these things and understanding, hey, what depth is going to be most beneficial to help this inflammation calm down, or to help the melanophage release the melanocyte that it has engulfed. All these things about skin are so important, and that is what makes us a better provider. And it's what allows us to help give a better service in the end. People for many years have thought like, you cannot use microneedling over melasma because it's going to cause worsening of pigmentation. But that couldn't be further from the truth. That's why knowing your depth is important. That's why knowing technique is important. That's why knowing, should I be doing 3 passes or 9 passes is important. Should I be stamping or not stamping? All of these things come down to being a good provider so that when somebody lays in front of you, you know exactly what technique, what method, what depth you're going to use. Because if you use cookie cutter depths for everybody, you're not going to get great results. And your clients are also not going to think microneedling is great. But I say this like humbly, but like there's a reason why so many people come back and back and back to my business for microneedling, and it's because we treat every single person differently. We treat nobody the same because nobody is the same. So that's what makes you stand out as a provider, I would say.
Totally. Okay. The idea around microneedling for acne is like a bit taboo, and you kind of started to you were the first one really who went public with exploring that, and I'd love to know just a little bit more about that. Why do you think why is it so controversial?
It's controversial because it is so misunderstood. I see every day on the internet people calling acne an infection. You're going to spread the infection. You're going to spread the bacteria. And that comes down to somebody not truly understanding how acne functions in the skin. Acne is multifactorial. No acne comes from just bacteria. Otherwise, I would have acne all over my face after touching it, right? It's really a problem of inflammation within the pore. So essentially what we have is, first we'll get a sticky plug. That plug then creates an anaerobic environment. Without that anaerobic environment, that bacteria is not going to do anything because it's a natural part of our microbiology, like of our skin, I mean. So essentially, like, we get that plug, it creates this anaerobic environment, and then the bacteria is then able to thrive, and it starts breaking down the sebum. Then we get something called free fatty acids, and those free fatty acids are going to bother the follicular wall. It's going to irritate it. And that is where we start to get swelling, pus, things like that. But it's not an infection. It is an immune response. It's just the body saying, hey, I don't like this environment. It's reacting, but it's not an infection. And that is what people do not understand. So whether you take a pimple and spread it across your whole entire face, just think about how many people pop their pimples at home. Like, yes,
Yeah.
popping your pimple at home could be irritating because you don't get everything out, right? But the amount of times that I bet they don't do it sterilely, the times that I bet they wipe it or something,
Mm-hmm.
you know,
Mm-hmm.
or take a pimple and wipe it on your arm. Do
Mm-hmm.
you get a pimple there? Probably not,
Right. No.
because it's not an issue of bacteria. Like if it doesn't have the perfect environment, it's not going to happen. And so microneedling over it opens up those sticky plugs. It can go through biofilms. It will really penetrate the skin with oxygen. And what do we know about that bacteria? It likes anaerobic environments.
Yeah.
Well, if oxygen is present, it's no longer anaerobic.
Yeah.
So it cannot thrive where oxygen is present.
Right.
And then, as we spoke about earlier, it has the natural healing response. So it literally, you get inflammation for about 24 hours and then it takes out inflammation. So if you do have a bunch of inflamed acne, it's actually going to pull inflammation along with it. And that damaged tissue that we talked about, it's going to replace it with newer, better functioning skin. And in addition to that, it actually helps calm down the sebaceous glands. So if you're somebody with really oily skin and sebum is a part of the problem, you're actually going to teach your body to produce a more normal flatline amount of sebum. And over time, your skin begins to function better and we see less and less acne. I used to have a ton of acne. I did microneedling and I do microneedling all the time. Do I still get breakouts? Yes. But my skin has improved 1,000% since I first started doing this.
Yeah, I would agree. I've been an esthetician for 22 years. I've been microneedling for probably 10 of those. And I have always been shy to really, submerge myself into microneedling. I would do it occasionally once in a while, but because I'm so acne prone, I always shied away from it. And then I met you. So Natalie and I became friends through like a mastermind group that we both joined last year, full of aesthetic entrepreneurs. And we just quickly
became best friends.
Became BFFs, and she talked me into, trying microneedling for acne. And I did it on myself before starting to introduce the idea on any of my clients. And yeah, I'm 5 microneedling sessions in and my skin is totally different. Totally different.
Yeah, if somebody's watching this on video, please look at Natasha's skin, because are you kidding me?
Yeah, like I did everything, and I mean, I got 90% of the way, but that last 10% I just couldn't get. And I did my 90% just, through my own kind of holistic approach through nutrition and the other treatments that I do. But that last 10%, like just, it wasn't moving the needle. The oil production was still just like insane. I just constantly was dealing with texture. And then, just 2 microneedling sessions in, I was like, okay, it's starting to feel really different to me when I'm cleansing my face morning and night. And we do cortisone injections at our clinic for, those really deep cystic guys that have their own heartbeats.
Yeah.
I used to do that probably once a week in this kind of area of my face. I have not done it since our in-person mastermind in May.
Hey, that's so good.
Yeah. So yeah. And like you said, like we still get the odd hormonal like pimple, but they resolve within like 48 hours now, not 48 days, which is usually what was happening. And so everything's working better. I'm still a little bit oily, but it's like a nice glow oily now. It's not this like intense oil that I need to pat off with tissue paper partway through the day, So everything feels regulated.
Yeah, exactly. And even though we are getting our skin to function better, there is no cure for acne. So we know being acne prone, we get to deal with this for the rest of our lives. Yes. So cute. But we also know that personally, I still have scars, well, I mean, not as much because I microneedle a lot, but I still have remnants of when I had a lot of acne, and people that meet me to this day, they can't believe my skin because they knew me when I had acne and they're just like, dude, that's crazy. Like how different your skin is. And the one thing I can really attribute it to in my life personally is microneedling. Like I hands down have just seen it change life after life after life. And it's nothing extreme. And it's oftentimes in half the amount of time. And like you said, oftentimes, like you don't have to use microneedling every single time to fix acne, right? To heal it. But there are people, like maybe for like yourself, it's like you can get them so far and they're just struggling.
Yeah.
Introduce microneedling and you will see that their skin will change. It will make that change. And that's what I've seen. People go to the dermatologist and they're like doing well. And then they come to me because they go backwards and they're like, why am I here again? And I start doing microneedling and they're not going back to the dermatologist anymore for medications or anything like that because we have changed the way their skin is behaving. And that's just, what's not to like about it?
Totally. I feel a lot of the other more quote unquote superficial treatments, they can help train the skin to an extent, but we're really more managing with those other treatments. Whereas this one truly is changing the function of the skin and the way it works.
Totally.
The other things might be correcting certain things like scarring and whatnot permanently. That could be a thing, with lasers and resurfacing and whatnot.
Yeah.
But when it comes to managing acne through chemical peels and stuff, you're kind of just, you're managing at that point.
Managing.
Yeah. So no, I hands down swear by it now. We've actually started to include it in our acne journeys. We never had microneedling in our acne journeys before, and now it's part of our programs. So
and guys, I remember talking to Natasha the first time and she was like, so like, what do you mean? Like, you just like microneedle over acne? And I was like, yeah, girl. And we had like a whole conversation about it. And I like told her why. And again, I understand. It's like the first time you hear that, you're like, no, that sounds crazy, because our whole careers we're taught not to do that.
Yeah.
So I know I believe me, I know I've gotten enough comments on Instagram that whatever, like, what are you doing? Yeah. Like, just all I can tell you is if it were true, I would have client after client after client with faces full of acne. And I have literally, and I say this like factually, every single person who I have set out to clear, who has committed to a program with me, I have cleared using my microneedling. Amazing. Every single person. So I know it works.
Yeah, for sure it does. Yeah, hands down. What's your favorite combination of treatments for acne?
Like, microneedle peel.
Yeah.
I love microneedle PRP as well. But microneedle PRP is more expensive, and I definitely have less clients that do it because of the budget. So my favorite has really become microneedle peel because it's less expensive and I know I can just get amazing results with that. Yeah. The only thing that I would say is that PRP has less downtime and a peel has a little bit more downtime. But I love microneedle peel because one, you can just go after so many different types of skin issues. Like, we can do that for melasma. We can do it for pigmentation, acne scarring, acne, even rosacea, depending on the client. But like, there's so many ways you can do a microneedle peel, which again, I know is taboo because people think that you're going to burn somebody's face off. But going back to method, technique, type of product, that all rolls into what you're actually doing in the treatment room. I'm not doing 4 layers of chemical peel on top of microneedling. And as you know, I have a method to applying it. I only do certain types of peels, etc. And I get fantastic results. And it's like, it's just, seriously, I have cleared somebody's crazy acne in 3 sessions of a microneedle peel. Like, cleared it. And that is the power of that treatment. Like, just knowing how to do it correctly is key. Please don't do it willy-nilly. Yeah. But
take one of Natalie's courses before you guys to play with this idea for sure. But
yeah, and it's like, people, I get messages a lot like, well, can you just tell me how? And it's like, no, because it's not, I don't want you to do it unsafely. I want you to do it safely. But once you know it safely, you will change people's skin time after time with that treatment. So it's definitely my favorite, I think.
Is there any type of acne you won't treat with microneedling?
So no, I mean, I treat all acne that is acne. If I look at somebody and I can tell that, let's say they have a lot of fluid around a lesion, it's very loose, it's warm to the touch, I'm not going to touch that because that is no longer just acne. But when I'm looking at true acne, even when it comes to cystic acne, I treat all of that. I treat fungal acne, closed comedones, even blackheads that are relentless on clients. I will treat that. And it works every time. Every time.
Okay. What mistakes would you say that you see a lot of other estheticians or practitioners doing when they're giving this type of treatment? Like what are they doing that's giving this treatment or this combination a bad reputation?
Number one is that I see a lot of people add a ton of pressure when they are microneedling. That is one of the number one things. Like, we shouldn't be looking like we're moving the skin when we're microneedling.
Right.
Like, skin's gonna move because it's skin, but the tool is there to do the work. So you should be gliding like
Yeah.
this, not like this, right?
Mm-hmm.
The other thing that I see is that people always, or people who do, okay, please. Let me hold on. Let me gather my English. People who always go to pinpoint bleeding as their clinical endpoint, because it's not wrong to see blood, but it shouldn't always be pinpoint bleeding as your clinical endpoint, because some people have delayed erythema. Some people don't bleed as easily. And then what you can do is you can end up over treating the skin. We want controlled injury, not chaotic injury, not chaotic inflammation. So my biggest kind of like suggestion there is to count your passes to make sure that you are staying within a certain range, because not everybody has the same skin. For example, my sister, one of them, she like does not bleed. I think she might be a vampire. She doesn't bleed. So like if somebody were microneedling her and they're trying to get pinpoint bleeding, they're 100% going to overtreat her skin. And in this type of treatment, the rule to getting good results is to treat accordingly, not to treat over the top. Like, more is not always better. Now, I know I just talked about microneedle peels, but if people know how I do them, I'm not really doing more. I'm treating like very conservatively still. But over treating the skin is an issue. And I see that over and over again. I see people with track marks on their face. They're getting a ton of swelling because they just had way too much done to their face in one treatment. It should be a series of treatments, not let's fix your whole entire life with one treatment.
I also think that there's a bit of like an issue with practitioners maybe assuming that all pens are equal. And
Correct.
they're following, say, your profile and your techniques, but they have a pen that's engineered to do something completely different, or that's not even properly researched and not going at the depths that they say that they're going at. And so I think that's a huge problem in our industry as well when it comes to giving people or the treatment a bad reputation sometimes.
Correct. Because skin pen itself, we can work on any color of Fitzpatrick and it is safe up to 1.5 on the face. But when I'm doing my courses and people ask me, well, can I work on a Fitzpatrick 6? And they don't have skin pen, I say, well, that is your responsibility to look with the manufacturer and see what the parameters of that device are. If you don't know the parameters of your device, I'm going to need you to sit down and read a book, because that is very important to know what our device is, said to be safe for. But yeah, like, I definitely think knowing your device, knowing, is it safe for Fitz 5 and 6? Or is it only safe 1 through 4? Because I feel comfortable working on all Fitzpatricks, but I also know that skin pen has been FDA cleared for up to 1.5 on all Fitzpatricks. Not to say that I don't prep the skin, not to say that I don't take precaution when doing it, but I do know that I'm safe to use that pen. And I would hope that everybody listening can say, yeah, my pen is safe for that, or no, my pen is not safe for that, because you should know those little details about the tool that you are using.
Yeah, absolutely. Even technique, like, going circular motions versus up and down motions. Like,
stamping.
Yeah, all those things are very pen dependent as well. So that's also very important to know. Let's get into some other myths and misconceptions. I think those are really important to talk about. What would you say one of the biggest myths you hear about microneedling is? I know you're going to say acne. Is there anything else that you can add on to that, you think?
Honestly, for all of them, one thing that I always hear is that if you're working on an inflammatory condition, that microneedling makes the inflammation worse. So I just want to say this like very, straightforward. But when you do a microneedling session, you're going to have from hour 1 to hour 12 where your skin is calling in those pro-inflammatory cytokines, which are the inflammatory markers in the skin. From 12 to 24 hour mark, from the 12 to 24 hour mark, actually, that inflammation kind of starts to decrease. So it peaks at the 12th hour, and then it starts to decrease as it's calling in those growth factors and fibroblasts, etc. So no matter what, if we're working on rosacea, melasma, acne, etc., we are not making inflammation worse. It's actually going to be, I would say, 100% better. It's not going to take it away in one session, but it is going to be so much better from doing this treatment if you correctly know how to treat the skin, because of the fact that it pulls inflammation on its way out.
Mm-hmm.
I think that's the number one, besides acne spreading.
Yeah, I think people are just really feeling cozy with just the idea of using it as an anti-aging or scarring treatment. And yeah, you're right. Like it's been a game changer for inflammatory conditions for me too. So that's, needs to be considered a little bit more for sure in the industry.
Yeah.
Now. We kind of covered this a little bit, but is more aggressive better?
No,
Microneedling?
absolutely not. And I get this question a lot. Like, it's like, oh, well, or people want to do 5 things in one treatment.
Right.
Like, they're like,
Stacked
I want to do this, and this with microneedling. And I'm like, why would you do that?
Mm-hmm.
Like, adding to it is not going to get you necessarily better results.
Right.
Like, I have a lot of people that put on topicals post microneedling, and you know my theory. I put nothing on the skin for 24 hours. And guess what I'm known for? My results, right?
Right.
And I get those results without putting a crazy amount of stuff on the skin after microneedling. So if I can do it, you can do it. And I will say that these people that are using all these things are typically not known for the amazing results that they're getting. Like, they're getting good results, but like, I'm telling you, I'm getting these results and I'm doing nothing after the microneedling. So I think that technique, method, frequency, all of these things play into account, and just letting the treatment do its job versus trying to do 5 treatments in one.
I agree. Yeah. Especially right now, there's just so many growth factors and peptides and PDRN and all these things that people are adding. And at the end of the day, if you just do it right, your skin's going to holistically do what it needs to do. So
yeah.
Okay. What is your thoughts on, like, this has been a pretty big trend on TikTok and stuff, is like at home microneedling devices. What's your thought on that and people doing it by themselves?
I'm scared. Okay. So there was a lady that, I don't know if you follow her or not, and most people that speak English probably don't, but Ren Beauty, right? She speaks Spanish, but she's a cosmetologist in Mexico. And she just did a video over this lady. Her and I found this article and we were looking at it together. This lady did microneedling at home at 0.25, which is not deep, right? 0.25 is only in the epidermis, which people have always said this is completely safe because your skin goes through desquamation and it's going to shed, etc. This lady used it was like a vitamin E oil that was meant for microneedling, and it was a professional product. She used it at home. She got one of the scariest granulomas I have ever seen in my life.
Really?
And I'm not even playing. Let me see if I can find the picture for you. Like, I mean, if people are watching this, right, they'll be able to see it. But
yeah, totally.
It is literally the scariest granuloma of my life, and it came from 0.25 at home.
Oh, no.
Like, is that real life? Okay.
Wow.
She got steroids. She was on, like, antibiotics. And then when it healed, this is it.
Oh, wow.
So, like, this lady had literally learned how to do it off the internet. She used a professional product that was supposedly meant for microneedling. She did not go over 0.25, and that is what she ended up with. So when I see people buying stuff off of Amazon or whatever to microneedle their face at home, and they're doing like 1.0 or 1.5, I'm like, first of all, you have no idea that you're in the dermis. Second of all, what the heck? Your moisturizer is not supposed to be in the dermis, like stuff like that, you know?
Totally.
And it's terrifying. Like, if I myself, as someone who does microneedling every day, am teaching classes to people how to treat acne and melasma and anti-aging, etc., and these people that are taking my classes have licenses, How can somebody at home that's had zero training expect to understand exactly how this treatment works? It's not something we should be doing at home. It's not even something that every practitioner should be doing, or, you know what I mean? Like,
So true.
people need the education.
Yeah.
If you don't have the education, don't do it, because it is a much bigger risk than people understand.
Yeah. And when you think about some of the tools that people are using to do it at home, like the derma rollers, like that is not the same type of injury.
No.
And it's not, like you said, it needs to be controlled injury. There's nothing controlled about that. You don't know what depth you're going. You're going in and out at different angles. So you're creating more of like a triangle injury in the skin rather than a quick insertion of a needle. Like, it is entirely different and so unsafe. So if you're listening,
don't do that.
You've been thinking about it, don't do it. Please. We'd rather see you to improve your skin, not fix your skin from scars that you've created with microneedling.
Please.
So, yeah.
I want your face to stay cute. Don't do it.
Yeah, exactly. Okay, so let's talk a little bit more about like practitioner perspectives. And, you know, there's definitely some pros that are listening to this podcast. So what would separate, we're kind of repeating ourselves a little bit, but let's for the sake of the pros listening, what would separate a good microneedling treatment from a great one, in your opinion?
Again, I definitely think method and technique. Like, when I went to school, I'll give you an example. When I went to school, my teacher was like, okay, we can treat pigmentation, and what we're going to do is we're going to get in there super deep and we're going to break up the pigmentation. When I teach my class, everybody is like, yeah, that's what I was taught. That is so wrong. Like, we absolutely do not want to do that. That is why microneedling got the reputation of making melasma worse, because people are not using the right technique, not using the right depth, etc. And so when it comes down to somebody that's going to do a good treatment versus a cookie cutter treatment, it's going to be the person that understands what layer of skin they're working in, understands the condition that they are working on and how it's triggered, how it's going to get better, etc. And then also, like, how many passes are we doing? What type of technique are we using? Are we stamping? Are we gliding? Are we doing both? Like, all these different things make a big difference.
Yes, you guys, the school that you go to is not the end all be all. Everything starts to come after. So, like, if you're interested in specializing in microneedling, you have to take Natalie's courses. They're just so informative. And like I said, I've been doing this 22 years and never once did I entertain the idea of microneedling the way that Natalie does. And it's been like totally changing me. So, okay. Let's summarize this all for our listeners a little bit. Just some quick questions for you. Who would you say microneedling is perfect for?
Unless they are not cleared by a doctor, right? Or if they're using Accutane, something like that, I'm not going to work on them. If they have an autoimmune disease that could affect, then we're not going to do that. But like the typical person that walks in with a typical skin problem, lay down, I'm going to microneedle your face and it's going to be so great.
Yeah, for sure. Okay. And who should approach it a little bit more cautiously?
Well, definitely somebody with like rosacea, melasma, or darker Fitzpatrick. Like, for example, with the darker Fitzpatrick, it is a non-negotiable for me that they need to be on a tyrosinase inhibitor.
Yeah.
Because I want to take care of them as I should, and that is our responsibility. So things like that, making sure that we're treating them correctly.
Do you usually have them pre-prep as well for microneedling for Fitz?
Yes. Yeah. I will do like maybe start them with an enzyme. I'll do a chem peel. I make sure that they're on a home regimen. If they're not on a home regimen, we're not doing it.
Yeah.
Totally. Even though it's safe, like per the company, to do skin pen on any Fitzpatrick, I still want them to be careful. You have one face.
Yeah, for sure. That's not something to mess around with. 100%.
Yeah.
Yeah. And if someone is acne prone and scared of microneedling, what would you say to them?
I would say, the way I usually will break this down to people, it's like, hey, well, okay, acne can't live where there's oxygen, right? So when we do microneedling, we're essentially doing oxygen penetration into every single part of your face. And also long term, we're going to change how your skin functions. So being acne prone doesn't mean anything. Are you going to purge? Probably, but you could purge after a facial. You could purge after a new face wash. So you shouldn't be scared of purging, but what you will notice is that overall your skin just becomes better. And if you're scared of doing it, like, just go look at my page and look at all the before and afters. It's
Yeah,
going to be okay.
for sure.
You'll be all
With
right.
with those people who are purging and are acne prone post microneedling, like we've had a couple cases where we were exploring this, and that was the outcome after the first or second treatment was a lot of purging, and then there was a little bit of shyness around continuing to try. What would you tell those people?
I would say, just like what we were talking about with the gym, like
Yeah,
when you go to the gym at first, you're going to feel kind of sore.
it hurts
And
real bad.
yeah, when you start working on acne, you're going to purge. The only fear around it is that it's microneedling. Because
Yeah.
if we were to do a chemical peel and somebody were to purge, we know that that's part of the process because we've been taught that.
Hmm.
So just changing the mindset of this is another treatment to treat acne, but acne forms in the skin sometimes 90 days before we see it. There's
Hmm.
these microcomedones in the skin. So as we regenerate the skin and skin moves upward and outward, we are going to see those microcomedones come up and out, but it does not mean that acne is spreading. It means that we are getting rid of the problem, essentially. So you just got to keep going forward. If you're sore one day, you still go to the gym the next.
Yeah,
You don't
true.
just stop going. So with microneedling, it's the same. If you purge, next month it will get better. And the next
Hmm.
time you do it, it will get better, and so on.
Hmm. And there's other, there's other treatments or technologies that you could do in between your microneedling sessions to really help with that. Like just something as simple as LED light therapy can be really helpful in that
Correct.
process. And yeah,
And everybody should be on a home regimen too. Like,
absolutely. Yeah.
I wouldn't do microneedling on somebody that isn't washing their face at night. Like,
No,
it
absolutely.
should be both.
Yeah. And products matter too. Like we're not just talking
Hmm.
any Sephora product. There's intention behind the products that we carry, sell, and
Correct.
recommend to you guys. Okay. What excites you the most about the future of microneedling?
I am excited about the fact that I think the industry is changing. And I think that we may have a more long-term treatment for acne than treatments that we have seen in the past. I think that the longevity of somebody's skin being clear is going to become more like it's going to become better. So instead of doing a chemical peel and then, in 3 months, we might need another chemical peel because they're starting to break out again. With microneedling over time, we're actually changing the function of the skin. So it's not just we're getting rid of your acne right now. We're changing the trajectory of your skin long term. And I just feel very excited about that because as somebody that has acne prone skin, it's terrible not to know, like, am I going to break out like crazy this week? Am I going to have my pictures ruined? Is my wedding, am I going to be breaking out on my wedding? Like stuff like
Mm-hmm.
that. Microneedling can actually help, give people confidence that that's most likely not going to happen. You might have a pimple or two because I still get those. Natasha still gets those,
Yeah.
but it's definitely different from what we used to experience as acne prone people.
Totally. And I feel that as acne prone people too, we're constantly, especially us who are getting a little older, like we're constantly battling, what treatment am I going to do today? Am I going to focus on the fact that I'm getting old, or am I going to focus on my acne? And we were kind of always going back and forth. And anytime I was doing something that was really anti-aging focused, my acne didn't like that, and vice versa. And so what a amazing thing that finally there's something that I've discovered that works for both of those things for me. And they've addressed
Mm-hmm.
those two concerns and more. Everything has improved. So
Yeah,
there we
totally.
go. Like a one treatment cures all. What? That's what
Yeah.
we've been hoping for. So, okay, let's have a little fun, and we're gonna do a little bit of a rapid fire. So, what's one skin myth you're tired of correcting?
I'm just going to say I'm tired of saying that acne spreads. It's annoying at
Yeah.
this point. I love
Yeah.
you all, but acne does not spread. I love you all, but please just go research that one for me.
Yeah. And luckily we're finally starting to see good information
Totally.
out there, which is amazing to.
And people are starting to come around, but it's just like
Yeah.
people cannot imagine. I still get comments to this day like, "Oh, you're trying to play God. You're going to ruin that person's face." And I'm like, "Okay, please just go look up the definition of acne. It doesn't say infection. It says
Mm-hmm.
multifactorial dysfunction of the skin." Okay. I can only
So
help
true.
people so much. Yeah. Like, I don't know.
And what would you say is the biggest microneedling no-no?
Putting stuff on the skin while microneedling. So, for example, using an exosome serum and microneedling that in to the skin. It is a terrible idea. That is how we end up with granulomas. That is why we don't put anything on topically afterwards. Like if you guys just, if you guys aren't sure what I'm talking about, I encourage you to go look up granuloma from microneedling and look that up. I already showed the pictures, but it's terrible and no esthetician can get rid of it. It must be treated by a doctor. Sometimes they cannot get rid of it.
Mm-hmm.
Sometimes the only way to get it out of the skin is to physically cut it out of the skin. So it's just not worth the risk. That to me is the biggest no-no. Don't put anything on the skin. Let the skin do its thing. You'll get great results without it.
And you'll save money.
Yeah. Now PRP is the exception, and chemical peel, the right type of chemical peel. I want to stress that, not any chemical peel, but the right type of chemical peel. I would say those are the exceptions because of how they work with the skin. PRP, it's your own, you're just putting your own stuff back on your face. So you're not going to have a reaction. Microneedle peel, again, the type of peels that I use, they work and then they stop working. Like you're not at risk the same way as you are for like an exosome serum being pushed into the dermis.
Okay, that was awesome. That was super informative. Thank you so much for your brain. You have so much knowledge around microneedling, and I am so grateful to have met you and that you have taught me. I've also taken her classes. They are so good. But where can people find you?
So on Instagram, it's at luxandlav, LUXNLAV. And then my website is My Lux and Lab, which I know it's not the same, but somebody already had my web address, if you can believe that. I know, I felt very offended. And then same with my TikTok, it's My Lux and Lab.
Okay.
Yeah.
And how can they get access to your courses too?
On both TikTok and Instagram, I always post, there's a link in my bio for both of them, and they always have the master classes, the upcoming master class on there. Now we do them based off demand. So sometimes people ask me like, can I get your schedule for your next master classes? And I don't have that because it truly, we do them based off of demand. But like right now we have a microneedling over acne class. And then after that, we're doing a class, which is not microneedling, but it's function of the skin. And that one is pretty in depth. If you want to learn truly how skin works, I think it's a great class for anybody who's an esthetician. And then after that, I'll be doing my melasma, rosacea, and acne scarring class again.
Awesome. Okay.
So,
well, thank you so much for coming and spending this, what has it been, an hour with me. I really appreciate you, Natalie. You've been such a good friend and mentor. And I just
you're mentoring me.
So, oh, girl, you got me.
If you guys don't know Natasha, she has like a business in Canada. Also, I love Canada, so that's why we also get along.
Yeah.
But honestly, she is like I would call you like a boss, like an actual boss. She has built like an empire underneath her. And it's just crazy to see what women can do.
Yeah.
Like I feel proud to be your friend because I know how big you've like become and how much you've struggled to get where you are. And that's like an example for literally every esthetician out there. I'm struggling right now, but I know you did it. And so I'm like, okay, I can do it too.
Yeah.
I'm on it.
Well, Natalie has built this amazing business just with, one room. And now she's expanded into this big, beautiful facility that they're going underway with. It's like such a beast to do construction. So good on you. But yeah, she has an amazing business under her as well. So hang on tight and have a look at her space. Probably in like a couple months, you'll be ready to roll, you feel, or?
Yeah.
Yeah.
And I want to tell estheticians too, like, get a friend that truly is happy for you. I've told Natasha a lot of my wins over the past year. Like, hey, guess what I did this month? Guess what my business did? And every single time you've always told me like, that's amazing. It's never been jealousy or anything weird like that. It's always like, dude, I'm so proud of you.
Yeah.
And that is what it should be because our businesses don't affect each other.
Not at all.
If you make $1 million, if you make $1 million tomorrow, I'm going to be like, oh my God, that's my friend, bro. Like that is my friend. She just made $1 million. What the heck? Like be happy for your friends. And I don't know. I want to say that because it's so important to have a good friend and to be able to share with them and to uplift your friends.
Yeah, no.
Yeah,
Yeah,
but
community over competition for sure. We
yeah.
can lift each other up. Yeah, there's enough people in this world that we can all treat and do it better if we're working together.
So thanks for having me, friend. I'm excited. I hope that we can do another one of these in the future.
Yeah, hopefully in person. Maybe you could come to Canada.
Yeah.
I'll make my way south. But
I would love to go to Canada.
Yeah, you should come.
Yeah. If you want to invite me,
You're invited.
Business expenses.
Yeah, totally. Okay, awesome. Well, thank you again.
Okay, friend. Thank
we'll
you.
do this again soon. Okay.
All right. Bye.